First, always in our group.
Okay, Senator Black.
Thank you very much, Cathaoirleach, and thank you very much for inviting us along today. We were all really delighted. I suppose I just really, and I hope this is okay, I just wanted to speak on a specific issue that I'm really, I suppose, concerned about. And again, my own background in working in this area for a long time, well, I suppose since 2003, and in doing so, working particularly in the addiction field, I've learned so much, particularly from family members, and the impact of specifically alcohol or harmful drinking on the families and particularly children. And we know that in Ireland we have a huge problem with alcohol. 3 people a day are dying from an alcohol-related illness, which is really scary. It costs the Exchequer 800 million. Alcohol alone a year. 1,500 beds in Ireland are taken up with a day with alcohol issues, and it's huge. And we're talking here around harmful drinking. So I really wanted to talk about the hidden harm piece and the wide range of harms that are caused to children as a result of parental alcohol misuse is known as hidden harm. As the harm is often not publicly visible, this means that these children are often not known to the appropriate services, and they suffer harm in a number of important ways that can impede their physical, emotional and social development. These children can suffer in silence, they often do not know where to turn for help, and the impact of the parents' harmful drinking has a deep and long-lasting impact on their lives, which may not fully emerge until young adulthood and beyond. For a child, harmful parental drinking can shape their every moment from the time they wake up to the time they go to bed. Will mum drink or dad drink today? What mood will they be in? Will I go to bed hungry? A child can take on the role of a parent in the family, making sure brothers and sisters are fed, getting them dressed and out to school. In the most severe cases, a family situation can deteriorate to the extent where children are emotionally abandoned, physically or sexually abused or neglected, dirty nappies going unchanged, children going without regular meals. So I've done some research on this, Cathaoirleach, and I just found this amazing woman in Stanford University, Dr. Stephanie Brown, and she talks about the developmental impact of parental alcohol misuse on children's attachment and identity formation, and the impact of alcohol misuse-related trauma on all aspects of development. The earliest research emphasises the link between parental harmful drinking and mental health issues, and this is the area that I'm specifically interested in, because what we find is that children who are reared in homes where there's harmful drinking have a very, very high rate of mental health issues. And then we look at our suicide rate here in Ireland, and then we look at our addiction rate that we have here in Ireland, and how children can go into having alcohol or problems misuse themselves. Many researchers found that children with parents who misuse alcohol are more likely to experience symptoms of anxiety and or depression, antisocial traits, relationship difficulties, behavioural problems and or alcohol abuse themselves. Children living with this trauma may develop a sense of self that is equated with defence. These defences are designed to keep the enemy out, to minimise anxiety, fear and the threat of humiliation. The defence of self or false self creates a deep sense of inauthenticity and a barrier to connectedness with others that exacerbates isolation and loneliness. The defensive mantle tends to be brittle, inflexible and self-reinforcing, with the potential to break down under stress. Over time, this cumulative trauma can engender trauma-related symptoms such as depression, anxiety, hypervigilance, low self-worth and somatic disturbances, head and body aches, chronic tension and so forth. I mean, it's shocking really when you look at the actual evidence that comes up around this. These symptoms, if they go untreated, can become full-blown PTSD. They can lead to all sorts of life learning, health, psychological and relationship complications and a desire to self-medicate. This is how insidious the baton of addiction gets handed down through the generations. Problematic use of alcohol and other drugs is a complex issue and continues to be one of the most significant health and social challenges facing Irish society today. Approximately a third of people of Ireland are engaged in harmful drinking. I'm not talking about even addiction here. I'm talking about, our binge drinking culture. This affects families and communities and can have serious implications for the welfare and safeguarding of children from conception right throughout their lifespan. Children living with the everyday experience of problematic use of alcohol may experience incipient or traumatic neglect, physical and emotional abuse, lack of appropriate nurturing and adverse outcomes which may affect their adult lives. So I'm going to skip, I'm going to really jump because I'm kind of repeating myself here. I suppose I really want to talk about what I believe, what we can do to prevent this, which is, I know myself and I've seen it. I've experienced this with the work that I've done with families in particular. So it's really important that we look at effective prevention and early intervention for children living at homes with alcohol or substance misuse. The children who live with parents who have drug and alcohol problems are amongst the most vulnerable in society. It is imperative that we ensure the best possible start in life for every child through effective prevention and early intervention. A holistic recovery-based education and therapeutic programme for adult children of alcoholics. And again, this has been done in America and has worked very well, and there's evidence to prove it. The development and maintenance of a therapeutic alliance or quality treatment relationship based on mutual respect is an essential component of effective treatment for individuals who are adult children of alcoholics. Empathy, respect and belief in the individual's capacity for recovery are fundamental service provider attitudes and values. Peer support and continuing care is also another option. So I just believe that funding should be really, I suppose, recognised, because I really believe that because of our culture here in Ireland, particularly with harmful drinking, the impact of it not only on our society with regard to mental health, addictions, but also physical. I mean, there is proof, there's a huge evidence piece done in America called ACE around the impact of dysfunction in the home and how it can actually impact people on a physical level, stress-related illness like cancer, heart disease. You know, it's just the whole look at our this is where the future of healthcare is really important, and how this plays a huge role, particularly with children, and how important it is that we recognise it. And it's not really recognised at the moment at all, really, in our healthcare system. So that's why I just feel funding should be made available for people who've been impacted by parental alcohol and substance misuse. It will prevent the legacy of mental health and addiction issues, and even health issues, you know, physical health issues, which has been passed down through the generations. And finally, there should be a consensus that integration between mental health and addiction service is sorely needed and long overdue. Again, we can talk about dual diagnosis. There is now an equally pressing need for transformation to recovery-oriented care in both systems. And again, it's about, as my colleague here says, it's really about that integration services that we have to really work together in partnership, and it's absolutely vital. So I hope I didn't talk too long. I'm sorry if I did.
That's great. Thank you very much.